in the middle of the second line, you'll see high quality and affordable benefits. The key here is that we're trying to do our best to balance these two important objectives. We want to make sure that we get you those high quality benefits, but we need to do so at a cost that's affordable to you and affordable to the taxpayers who also pay for a portion of your benefits. This second challenge, I will say, affordability is getting harder and harder as healthcare costs that underlie the premiums continue to rise. So we'll touch on that a little bit more later on in the presentation. So our goals on the next slide, first two, of course, come directly from our mission, as I just said. The third, because the GIC is as big as we are now with over 400,000 members, we also have the opportunity to influence the healthcare market broadly in the whole state. And we take that responsibility very seriously, whether it's focusing on expanding access to behavioral health, working to ensure greater health equity in our system. We have the opportunity to work on a number of other statewide challenges. And then finally, we're focused on being as efficient and effective as we can be so that we can serve you well. We want to be able to provide the tools and guidance to manage your own benefits. So we're always working to improve the way that we operate. We have very small staff, so it's important we can be as efficient as possible. So here, just a quick reminder of the range of benefits that the GIC offers. That includes health, dental, vision, life, and long-term disability insurance. As many of you know, we also manage the healthcare and dependent flexible spending accounts, as well as Mass for You, which is the employee assistance program. Those latter two programs, of course, depends on which public employer you work for in terms of eligibility. Please note that these may not each apply to all of you. On the next slide, just some key facts about the GIC. We're now 455,000 members strong, including 110,000 retirees. This makes us the largest purchaser of healthcare in the Commonwealth. And we do that through a $3 billion annual budget from the state. We're also governed by a 17-member commission, as you'll see here, broadly representative of a number of unions that represent our members, a seat for a retiree representative, including two members of municipal management as well. And lastly, just on the lower right-hand side, most folks think of the GIC as health benefits for insurance benefits for state employees and retirees and some municipalities, but we also work with a wide range of different public sector employers throughout the state at the statewide level, as well as regional and local levels. This slide illustrates how the GIC benefits are funded. Won't be too much of a surprise, I suspect. In the blue portion of this pie, the Commonwealth of Massachusetts, through the state's budget, funds a significant share of your benefits. That will vary depending on your date of hire. In the light green, the cities and towns that also purchase through the GIC for their employees fund a portion of your premium. And then finally, of course, in the purple, you, our members, also pay a portion of your premium, which in most cases is a deduction from your paycheck or from your pension. So those are the different sources of revenue. And without getting too much into the weeds here, I wanted to note that the GIC's health benefits are financed in a little different way than you may be used to or heard about from other employer health plan sponsors. We're self-insured, which means that the GIC, and this is through the state budget, holds essentially the insurance risk. It's not the insurance company that you're enrolled in. So when you receive healthcare services, your doctor or hospital will send a bill to the insurance company that you're enrolled in, and that company in turn pays the doctor for that service. So those insurance companies then bill the GIC on a weekly basis, and we then reimburse the insurance company for those claims. So an important implication of this is that if over the course of the year, our members use more healthcare services than we expect or project, the state pays more, but you, the members, do not pay more. And if our members use fewer healthcare services than expected, the state will pay less, but the insurance companies are not getting paid more in that instance. We pay our insurance companies through a fixed fee based on how many GIC members they have. So I hope that's a little helpful to understand how the dollars flow and what it means to us. So before we move on, I just want to remind you of what Erica said at the outset. If you have a question, we'll be taking those at any time. You may submit those in the Q&A tab, typically at the bottom of your Zoom screen. We'll go through and answer as many of those in writing real time as we can and pull out a few to address verbally with the group. Also, just to protect your privacy, please, if you have questions about your specific coverage, submit them by the online contact form or on the phone number listed here on the slide. So in the next section, we'll remind you of the insurance companies and other companies that we work with to provide you these benefits. On the healthcare side, really nothing is changing this year in that respect. But there are a few other changes that we want to make sure that you're aware of. So in the area of what is not changing, there are no changes to the companies that we work with to provide your pharmacy benefit. If you're one of our enrollees in our active employee plans, CVS Caremark provides your benefits. And if you're enrolled in a Medicare plan, CVS SilverScript will be providing your benefits. That will continue to happen. So no major changes to the plan. We'll just note, of course, as always, CVS may make changes to tiering of drugs and your copays, or occasionally a change to the drug formulary during the year. But aside from that, the plan is staying the same. Similarly, the company that we work with to administer our flexible spending accounts, this is Task, will continue to provide those benefits to our state employees. On the health insurance side, we will continue to offer the same plans that we have since fiscal year 2024. We're making no changes to these plans. We continue to offer our Harvard Pilgrim Healthcare Access America plan on our national network. On our regional network on the upper right, Health New England will continue to serve our members in Western Massachusetts. We have a range of broad network plans through WellPoint, Harvard Pilgrim, and Mass General Brigham, as well as our limited network plans through Harvard Pilgrim and WellPoint. As I'll say more about in a moment, unfortunately this year our premiums are rising pretty substantially. So even if you like the plan you're currently enrolled in, it's a good idea to log in to our member portal or review our member decision guides during this annual enrollment period, just to make sure that the plan that you have meets your needs. If the plan's premium that you're currently enrolled in is going up more than you can really make work, then it's a good idea to evaluate other opportunities, other choices that are available to you. On the Medicare side, similarly, we'll continue to work with the same companies to provide your Medicare benefits. We have 3 Medicare supplement plans noted here on the left through WellPoint, Harvard Pilgrim, and Health New England. And of course, on the upper right, we will continue to work with Tufts Health Plan on our Medicare Advantage plan, which is called Medicare Preferred. And with that, I'm handing it over to Cameron McBean, our Director of Vendor Management, to talk about 2 areas where there are changes to the companies that we work with. Cameron?
Thank you, Matt. Now that I finally got myself off mute, we wanted to let folks or make folks aware there will be a change in our dental and vision plans for fiscal year 26. As I believe we've mentioned, we do have to take all of our contracts out to procure, are out to bid again for and run a new procurement at most every 5 years. And as a result of this most recent one, we've got some favorable terms from the fully insured dental carrier that we're going to be going with. We're going to be moving back to Altus Dental. We've been with MetLife for quite a while now, and Altus will also be providing the vision coverage in partnership with VSP. Now, as a result of the better premiums that we got during this procurement, we are going to be able to increase the annual maximums for all 3 of the GIC sponsored dental plans. We have 2 that are available to active state employees who are not covered by a collective bargaining agreement, and then the retiree dental plan that is, again, not available to all GIC members. So the increase to the annual maximum means that if you have to get a significant amount of dental work or an expensive procedure, a greater portion of that charge will end up being paid. Currently, the MetLife plans stop paying additional benefits once they have paid $1,500 towards any individual on the plan's dental claims. That amount will now go up to $1,750 as of July 1st. We've also made a couple of enhancements on the new vision plan. Previously, active employees on the Davis Vision Plan were only receiving a covered eye exam through the Davis Plan once every 2 years. On the new Altus VSP plan, it will be annually that you can get an eye exam. There's also an enhancement to the vision program available to the retirees. It is a no-charge discount plan, but you will no longer have to contact Davis and prepay for your vouchers. You'll be able to receive your discount right at point of sale when you go and purchase your glasses from a participating retailer. Next slide, please. Okay, we can go ahead and move on to the next slide. While we're talking, going to segue from changes to dental to the tweaks that will be occurring within the medical plans. As Matt mentioned, there's nothing of any great significance and certainly not any concern for the membership in terms of what's being covered. We want to start off with a quick refresher on the timeline for how our premiums are set. So throughout the year, we are constantly consulting and receiving reports from our medical carrier partners, our medical consultants, and the actuaries that they employ, as well as reviewing our ongoing claims payments. And starting in the fall, we start trying to collate that data, communicate with the carriers, see what they expect in the year ahead. And then throughout this time of year, we're trying to tabulate and calculate what we think the premium equivalent should be. Then in February, once we've got those numbers, we present them to the commission, who votes to approve the premiums. And then those become effective in time for us to communicate them in advance of annual enrollment. And then those become effective July 1st. Next slide, please. Okay. We did have in our preliminary calculations, we are not an outlier in the market, unfortunately. We will be looking at higher increases than we have historically seen in previous years. That is not unique to the GIC in any way, nor is it unique to Massachusetts or indeed nationwide. There are a number of factors at play in that. We do not have, as I mentioned in the last slide, the premium rates will be finalized in February, so we do not have those available yet. We had a lot of requests for that information in the first session, and unfortunately, we do not have that available yet to share. Could we move to the next slide, please? So again, touching on some of the forces at play as to why we anticipate the premiums to be significantly higher. It boils down to inflation in large part. Doctors, provider groups, and hospitals are raising their costs at much, much higher rates of even the elevated inflation that the nation has seen in the last couple of years. Drugs are also driving the increase by a huge margin. Lots of people have heard discussion in the news or on TV or what have you, the commercials for Ozempic and Zepbound and Wegovy and all of them. You know, these are broadly available to a large population, and they are expensive. And so we are dealing with that adjustment as well. Next slide, please. So other plan design elements that will be new for fiscal year 26, in partnership with CVS, we are going to incorporate a program from an app called Hinge Health, and they target musculoskeletal conditions such as sprains, strains, muscle tears, physical therapy, that sort of thing. And it is just another avenue for treatment or assistance. We also plan to enhance and harmonize the fertility benefits available across all of our plans so that no member has more or less services available to them depending on which plan they're in, should they need reproductive assistance. We'll also be removing nutritional counseling limits as a result of our compliance efforts with the mental health parity law. And we can move on to the next slide, please. At the very end of December, the Massachusetts legislature passed what is known as the PACT Act. And that will have some impacts on the GIC. It will have the impact of increasing our spend somewhat. No new drugs will become available to GIC members as a result of this law, but cost shares will go down and in some cases disappear for some generic medications for a number of common conditions. The specifics are included in the slide here, and those updates will also be made to member handbooks in advance of the new plan year. Next slide. And finally, we wanted to touch on some other legislative mandates that have impacted the GIC over the course of the last year. In the current year's budget, we were very, very excited to see that the legislature has approved an increase to the basic life insurance benefit that most GIC members are eligible for, and that is included with enrollment in medical insurance for those members. Previously, the life and AD&D benefit was capped at $5,000, and it will now double to $10,000. Keep in mind, there is a small percentage of that premium that is paid by our membership, so there will be a small increase that goes along with that benefit, but it's If memory serves, it's going to be less than $1. We also will now cover enhanced or advanced imaging for breast cancer screening. Coverage will be included for human donor milk, as well as postpartum depression screenings and home services for those members having children. We've also got some updates to our pain management protocols, including removing some utilization controls for non-opioid pain medications. And then finally, also enhanced coverage for members or enhanced coverage of additional services for those members suffering from Down syndrome. Next slide. Okay. And with that, I'm going to hand things over to Paul Murphy, our esteemed and longtime Director of Operations.
Thanks, Cameron. On the next couple of slides, I'd like to walk to what you can do for annual enrollment. And as you can see on the slides, annual enrollment will take place this year from April 2nd to May 1st. During this time, members can change from one health plan to another, enroll in GIC health insurance or dental insurance. They can withdraw their coverage and they can apply for buyout. The benefit decision guides, as it states at the bottom of the slide, are going to be posted on GIC's website and the member benefit portal immediately prior to the start of annual enrollment on April 2nd. The guides will have plan information regarding the new dental and vision carrier. We'll have health plan phone numbers, email addresses, and it will also have all of the new rates that are going to take effect for July 1st. We'd like to remind members it's a good time to review all of your GIC benefits, review the benefit decision guides to see what's available, what's new. But we also want to remind members, if you don't want to make any changes to your health insurance, if you do nothing, nothing will change. We do not require our members to re-enroll in the health plan if members want to keep their same health insurance plan. Go to the next slide, please. For this slide, we'd like to remind everyone that in 2021, GIC launched a member benefit portal. It's available to all GIC members. The portal came about in 2021. We currently have over 110,000 members registered for the portal. The portal allows members to view their benefits in real time. They can see their dependents covered. They can make beneficiary changes. They can make plan changes during annual enrollment, and they can enroll in coverage throughout the year with a qualifying event. The portal allows the member to make the change, and it also has a step-by-step process in the portal to allow the member to enroll in benefits as well as their dependents. You can upload certificates, any documentation in the portal. You can also chat with GIC members, and we can also share screens in the portal to help you answer any questions you may have with coverages in the portal. We encourage people, it's a good tool, it's a useful tool, and we'd like people to take a look at it, register for the portal. I encourage members, if you're interested in the portal, to please try to remember to register before the start of annual enrollment. Our phones get very busy during annual enrollment, and we like to have everyone in the portal before annual enrollment so that it cuts down on the number of phone calls we get during annual enrollment. If you need assistance with the portal, you can call our main number, 617-727-2310. But we also have information on our website. We have tutorials, videos, how to register, and what you can do in the portal. So there's a lot of good information on GIC's website about the portal. The portal is one option for members to make changes to their GIC benefits. We also still allow members to submit forms electronically through our website using electronic enrollment forms. And you can also download enrollment forms, fill them out, and send them to GIC. So you have three options to enroll or change your benefits during open enrollment. The portal being the preferred, but we also allow you to submit forms electronically as well as mail them to the GIC. If you could change the slide, next slide. This slide is just giving you information regarding all of our health plans, their phone numbers, and their websites. We encourage you to look at the websites for the health plan you're enrolled in or what you're interested in enrolling in during the upcoming open enrollment. The benefit decision guide will also have this same information and will also have contact phone numbers and websites for our other benefits such as life insurance, long-term disability, and the dental plan. At the top of the screen, we'd like to give you some reminders about when you should call your health carrier. If you want to find a provider, accessing tiers, what your copays will be, doctors and hospitals that are in the network, programs available like telehealth or fitness, and any specific benefit questions should be directed to your health plan. One thing worth noting is that if you need an ID card, we get a lot of questions from our members that they need new ID cards or a replacement card. The health plan issues the ID card. So if you need a new health card, we encourage you to contact the plan directly and they can issue you a new health insurance card directly for you or any family member. And I think on that note, Erica, I can turn it back to you for the Q&A.
Thanks, Paul. I think I'll probably end up turning it right back to you, but I will go ahead and give our intro anyway. I did have someone ask in the Q&A if there would be a link to the presentation. And we will be providing that. I believe a link should be live shortly. We just had someone post it not that long ago from our earlier session. So we will get you a link to the presentation. It will also be included in a follow-up email that as a participant of this webinar that you'll get next week after all sessions have been completed. So we are going to turn over to questions and comments now. Paul, this is where I was hoping you could give us an overview of retirement. And Emily, if you could drop into the chat our classic Turning 65 video for folks to be able to link to. And Paul, feel free to take it away.
Sure. Thanks, Erica. What we thought we'd do here is give you a high-level overview when members turn age 65, what happens to their benefits, etc. If they have a spouse, an older spouse, a younger spouse on their plan. We get a lot of questions, particularly during annual enrollment. So what I like to do is go through some high-level common scenarios that we see, and hopefully that will help answer questions. As Erica said, we do have a Q&A on our website, and we do have a video about turning age 65 and what happens to your benefits. So the first common scenario is if you are retired from the Commonwealth and you have GIC health insurance, 3 months before your 65th birthday, GIC will send you a letter telling you what will happen at age 65 and give you instructions on what to do if you are eligible for Medicare Part A and Part B. The letter will give instructions, have all of the health plan options available to you, list all the Medicare plans. Under state law, you are required, if you are Medicare eligible, you must enroll in a GIC Medicare supplemental plan to continue your GIC benefits. So we will contact you as well as your spouse 3 months before age 65 if you are retired from the Commonwealth. The second scenario we hear a lot is if a member is Medicare eligible, they are retiring, and they cover a spouse who is under age 65. In a scenario like that, the GIC still requires the member to enroll in a Medicare plan at age 65. However, the spouse can enroll in any non-Medicare plan that the GIC offers. So rather than have a family policy in place, we will treat the membership as two individuals, The member will be on an individual Medicare plan. The spouse will be on an individual non-Medicare plan. In that scenario, the member can have any Medicare plan he or she desires, and the spouse under 65 can have any non-Medicare plan under age 65 that the GIC offers. We frequently refer to it as a one under and one over. The third scenario we get is if a member is age 65 or older and they retire from the Commonwealth, what happens? When we are notified by your HR department or your benefit office that you are retiring, GIC will send a letter to you as the member and your spouse, if you're covering a spouse, once we receive the retirement information from your department. You have 7 months from the date of retirement if you are over age 65 to apply for Medicare Part A and Part B. So the same process applies even if you're over age 65 and you are retiring. We will send a letter with instructions on what options that are available to you. Now, a couple of things to keep in mind, we get a lot of questions. There's two parts to Medicare. There's Medicare Part A, which is called hospital insurance, and there's Medicare Part B, which is doctor's insurance. Medicare alone does not pay all of your benefits in full. Most of the time, people will require to be enrolled in a Medicare supplemental plan. That's what the GIC offers to you as the member, and those plans are outlined in the benefit decision guide and our letter that we will send you. It lists all of the Medicare plans available. It lists the premiums and the benefits that are available, the copays, the deductibles. The deductibles and copays are lower for members that are enrolled in a Medicare plan. So I would encourage members to take a look at the benefit decision guide and look at those benefits. But again, Medicare Part A is hospital, Medicare Part B is doctors. You do need a supplement to Medicare, and that's what the GIC offers. Keep in mind, state law does require a member and or his or her spouse to enroll in a Medicare plan with the GIC if you are eligible for Medicare Part A and Part B. If you don't enroll in Medicare Part A and Part B when you are retired or turning age 65, the GIC can cancel your health coverage with the GIC for failure to enroll in Medicare. Another thing to keep in mind, Social Security is the only person or agency that can tell you if you are eligible for Medicare. GIC has no information regarding the eligibility. So you must contact Social Security directly or look at their website, medicare.gov, to enroll in benefits. So it is important to keep that in mind when you get our letter 3 months before your 65th birthday to start that process with Social Security to enroll in Medicare. Another thing to keep in mind, if you are not eligible for Medicare, say you work for state service all your life, we will require that you apply for your Medicare benefits directly with Social Security. And if you are not eligible, you will receive a denial letter from Social Security. In cases where members are not eligible for Medicare at age 65 or at retirement, the member and his or her spouse can remain in a GIC non-Medicare plan after age 65. So keep that in mind. A lot of people say they've worked for and they're not eligible. We will require the proof of ineligibility for Medicare. Once you supply that with us, you can continue in the same plan you had prior to age 65. So we put a lot of information out there. I'm sure they'll have some additional questions, but at a high level, we do contact you 3 months before 65th. We contact you at retirement. If you and your spouse are eligible for Medicare, then you must enroll in a Medicare plan. If you have a spouse that is younger than age 65, you can have a combination of a Medicare and a non-Medicare plan. So it's important to look at our letters when we receive it and also review the benefits in the benefit decision guide regarding the Medicare plans and monthly premiums. Think I can turn it back to you, Erica, or do you want me to talk about the buyout?
Thanks, Paul. You might as well just go right on and talk about buyout.
GIC offers a buyout program twice a year, once during the annual enrollment period, April 2nd to May 1st, and we offer another buyout in the fall. What the buyout program allows you to do is that if you are enrolled in a GIC health plan on January 1st, 2025, and you maintain that health plan through June 30th, 2025, and you complete a buyout application, which is available on our website or through the portal, you can buy out of your GIC health insurance plan. We will terminate your health insurance coverage, and then starting in August, we will either put a reimbursement in your paycheck, send you a check through the mail, but you're entitled to 25% of the full cost premium for the health plan that you are enrolled in through June 30th. It's a one-time deal for buyout. It's only 12 payments, and it is only for 1 year. At the end of buyout, you can apply for the GIC benefits during a qualifying event or annual enrollment. You're not locked out, but you can come back into the GIC. But I urge people to look at the benefits. It is a one-time 12-month payment, and that's how the buyout works during annual enrollment.
Thank you, Paul. To cover the last typical question that we usually get is about why or will the GIC offer an individual +1 plan coming up, and do we take a look at it yearly, and also why haven't we to date? So Matt, looks like you might want to jump on this one. So I will turn it to you.
Yep, we do regularly get this question, and this is a feature of coverage that is sometimes available through other employers. We have not to date decided to make any change to our current lineup of individual plans and family plans. So there will not be that sort of an option for the coming fiscal year. That said, we do continue to evaluate the option of having that type of a plan or that type of a plan type. So it is always on our radar, and we will continue to evaluate it, but no changes at this time.
Matt. So turning back to our questions here, it looks like we have one question remaining that is currently being answered. Let me just go back through here. So if you look in your chat function, just want to remind folks that we have a number of links that we've dropped into the chat, not the Q&A, but the chat function that you can access to get our FAQs, as well as our contact, our Turning 65 video, and a number of other items as well. The presentation is also, the link is also now live in the chat function. While I'm awaiting any additional questions here. At the moment, we don't, oh, here we go. Is there a plan for just employee and spouse, or would it be a family plan? So that's actually what Matt was just talking about, the individual +1. And as he noted, at this time, there are no plans to develop that at the time. So it would be, if you're more than an individual, it would be the family plan. Okay. Great. Do you have to be 65 to retire and get GIC insurance? Paul?
The rule to have your GIC benefits continue once you retire is if you are eligible to collect a monthly pension from the State Board of Retirement, Teachers Retirement Board, or a local municipal retirement board, you are eligible to continue GIC benefits when you retire, but you must be eligible for and collect a monthly pension.
Thanks, Paul. I think we had a follow-up here. There's an individual who isn't retired and they have GIC benefits for themselves and one other. This individual is enrolled in Medicare A, but is not retiring until June. Should the spouse have gotten a letter from GIC or not until the member retires?
Yes, the way it works is that if you are going to continue working after age 65, you can enroll in Part A, which is the hospital insurance, and you can defer the Medicare Part B, the doctor's insurance, with no penalty. Once you retire from the Commonwealth, you will be required to go back and enroll in your Medicare benefits. So in the case where somebody has Medicare Part A and they're retiring in June, once we receive the retirement information from your department, we will send you a letter regarding your Medicare options and to enroll in a Medicare plan with the GIC. But for members that are going to continue working after age 65 and you're covering a spouse, you can just enroll in Part A and defer the Medicare Part B with no penalty until such time you, the member, retires. We do get a lot of questions from members saying that they are retired, they're turning age 65, they have a spouse on their plan turning age 65, but their spouse is going to continue working through a private employer or another employer. If you are covering a spouse under your health plan and you are retired, it is mandatory that your spouse enroll in Medicare Part A and Part B, even if they continue working outside in private employment. It's your coverage as a member being retired that you've got to follow the rules as a retiree. So the GIC does require the spouse to enroll in Medicare A and B, even if they're working outside, if you, the member, are retired.
Thanks, Paul. So it looks like our GIC staff here is busy typing away answers to the last question that was posed in the Q&A. A lot of the questions we received were pretty personal in nature, and so if you didn't get a direct answer to your question, please reach out to us, and I can go back to the contact forms where you can get in touch with the GIC for your questions. Matt, was there anything you wanted to close with?
Thanks, Erica. Just a thank you to all of you who logged in this evening. This is the second of our 3 sessions, and we always get a great deal of value out of interacting with you through this format, answering as many questions as we can here in writing. But as you noted, this is not the only opportunity for folks to get answers to questions, particularly if they're very specific to you and your situation. We're happy to respond to those through our online contact form and the phone number that's listed here. We've got a team of people who would be happy to walk you through those specific issues. But just a thank you for joining, and hope everyone has a good evening.
Thanks, Matt. So again, we'll be following up with an email that has the link to the recordings as well as the presentation. And we look forward to getting that email out to you all next week once all of our reports, all of our sessions have wrapped. So thanks very much, everyone, and we'll see you next time.